opposed to the proposed legislation. I'm going to present a short statement, and then I would like to spend my remaining time making up a couple of points regarding last week's testimony. I'm here today to speak to you regarding the legislation that would eliminate physician supervision of CRNAs in South Carolina. I support the continued delivery of safe anesthesia care to the patients of South Carolina as it exists under current South Carolina statute. My goal is to present you with my personal experience in the delivery of anesthesia care in this state. I came to South Carolina in 1984, assigned to Moncrief Army Hospital as a newly trained nurse anesthetist. Having received a master's degree in nurse anesthesia, I worked with little to no physician supervision, as that was the military model at that time and may still be at this time. I left active duty after 4 years at Moncrief in order to attend medical school because of my desire to improve anesthesia care both in the military and in the rest of our state. After 4 years of full-time study, I graduated from the University of South Carolina School of Medicine. I completed a 1-year internship and a 3-year residency at what was then Richland Memorial Hospital. After passing written and oral examinations administered by the Board of Anesthesiology, I was board certified in anesthesiology. My first job after residency was at a small rural hospital in Manning, South Carolina. I was recruited there because the hospital leadership desired to change their anesthesia delivery system to a physician anesthesiologist-led model of care. I was there for 4 years and then returned to Columbia, where I practiced anesthesiology at Palmetto Health for 20 years before retiring last year. I also proudly retired from the U.S. Army Reserves after 20 years of service. So from my personal experience in caring for patients in this state, I have practiced as a surgeon-supervised CRNA. I have practiced as an independent practicing CRNA. I have practiced in the anesthesia care team model as an anesthetist and as an anesthesiologist. And I will tell you by far, the safest model for our patients is the anesthesia care team. Nurse anesthetists are valuable, respected professionals working under physician supervision to provide the safest care for patients of this state in various environments, which are often very stressful. But there is no justification for the elimination of physician involvement in the provision of safe anesthesia care to the residents of this state. Overwhelmingly, it is certainly safer for patients, as demonstrated by outcome studies, when a physician is involved in the delivery of care. Now quickly, I want to go back to a couple points that were made last week. Ms. Munn, Ms. Estet, I appreciate your military service. Thank you for serving, as well as your husband. Ms. Munn made statements about her husband being a CRNA working in a forward combat area, providing anesthesia. I spent several years in the military. I have a son who did 5 years in the Marine Corps, decorated combat veteran, 2 tours to Afghanistan. So I appreciate the medical care our soldiers provide, or were provided for. But should the standard of care for anesthesia delivery in South Carolina be based as the same as in a combat zone in a third world country? That's a question. Tom? Thank you.
Thank you. Dr. David Floyd.